Good morning, everybody. I'm just seeing if we're live. We should be live at this moment, waiting. It looks like we have an excellent connection this morning. I'm just waiting to see. There we go. This morning we have with us Dr. Valerie Stam and Patricia Hayward from Cowie, the City of All Women Initiatives. During this time of social and physical distancing, SACPA believes it's important to keep engaging with the public on issues of the day, and in order to do so, we are very thankful for the continuing support we receive from the University of Lethbridge, Shaw Spotlight, and the Lethbridge Herald. I'd like to introduce our speakers. Dr. Valerie Stam is the Executive Director of the City for All Women Initiative, also known, or more often known as Cowie, where she coordinates training and advocacy with community leaders for inclusion and equitable change in municipal policies. She's a facilitator and educator with over 20 years' experience in intersectional gender approaches to development, civic engagement, research, and policies, both locally and abroad. Patricia Hayward is a labor lawyer and a passionate advocate for human rights, especially women's equality rights and the rights of racialized people. As a member of the board of the City of All Women Initiative, a volunteer co-host of CHUO's Black on Black, and a board member of her children's daycare, she especially enjoys collaborating with others to discuss and address systematic barriers faced by historically marginalized communities. Welcome both. Thank you very much for taking this opportunity to join us here today. And I look forward, and I think we all look forward to hearing what you have to say.
Thanks for having us.
Thanks very much, Annalise, for that very welcoming introduction. And as you said, I am Patricia Hayward, a member of the board. And today we're going to be talking to you about some of our work, and specifically with respect to our response as an organization, very uncertain and unusual times in which we're living in through this COVID-19 pandemic. So I'm going to start just by speaking very briefly about Cowie, who we are, what we do. We're then going to talk a little bit about the open letter that we wrote to City Council here in Ottawa on a gendered response to COVID-19. We'll then talk about what Cowie is doing during the pandemic and what are the intersectional gendered impacts of the pandemic. So specifically, what are we hearing from members, from our supporters? And in addition, we're going to be talking about some of the recommendations that we made in the letter to the mayor and council and what has been accomplished so far. So that's sort of an outline of our presentation. So I'll begin with what we are. We are a unique collaboration of women, people who identify as women, and we work across diverse communities, organizations, and academia. And we work with municipal decision makers to really attempt to create a more inclusive Ottawa and to advance intersectional gender equity. The initiative, Cowie, as such, the organization, the precursor to it was the research action on women's access to city services in 2001. And at that time, I was a student at the University of Ottawa, geography student actually, and I had better access to decision-making structures and making concrete recommendations for change. So that's been my involvement with the project, and that's a little bit about Cowie. And of course, you can always also go to our website, which is cowie-ivtf.org, to get more information about the organization.
I'm just seeing if we're live. We should be live at this moment, waiting. It looks like we have an excellent connection. Go ahead.
So
Sorry.
I'm hearing Should I continue? Okay. Okay. So sorry, I was just hearing what had been said previously. So in terms of the actual open letter that we wrote to City Council and the Mayor, and Jim Watson, I want to talk about why we wrote a letter. So as a we were into, the second and third week of this shutdown of COVID-19 and seeing the impacts of this on people in the city of Ottawa, and in particular, the diversity of women that make up this city. And so what we noticed overall was that there was a pandemic planning. So in the city's actual response to this pandemic, we heard from insiders, I will call them that, within the city's equity infrastructure, and I won't name them, but there were in the city that were also of the same mind, that were looking for external support from community organizations to support that argument that really there was a lack of an intersectional gendered response, and that needed to be incorporated into the crisis planning that the city was involved in. So what we ended up doing as a group, as an organization, is we sat down as a board. We sat down with staff, obviously all over the phone, physically distanced, and we spoke about areas that we wanted to address. And we ended up with the letter that you will see on our website. So the letter to the mayor and addresses 4 key areas. One area is the issue of gender-based violence. So obviously, in a situation where people are forced to stay at home and are in fact being advised by public health authorities to stay at home, in a situation where we have states of emergency that were called across provinces, so Ontario being one example, but in obviously jurisdictions across this country, we noticed in Ottawa specifically, and we were hearing from women's organizations, that there was women who were facing violence, children facing violence, that were even more under the radar now. And so it was one of the areas where we felt there needed to be action on the part of the city in situations of violence. So the other area, this has disproportionately impacted certain communities, and the at-risk community, at risk of homelessness community, people who are couch surfing, refugees, newcomers to this country and to this city, obviously would have would be disproportionately impacted. So we addressed issues around homelessness in the letter. And then we spoke also about the gender division of labor and precarious work, the fact that in this pandemic, as we know, the majority of people who are doing care work, the people who are doing essential service work, the people on the front lines, whether we're talking about grocery workers or we're talking about personal support workers, or we're talking about people who are working as nurses in the healthcare system, this work is done by women, and the majority of work that involves cleaning or keeping spaces, public or private spaces, clean, this is largely due to the gender division of labor, the patriarchal division of labor. This falls on the hands of women. And so we wanted this to be as well addressed and considered in the city's response and pandemic response planning. And finally, the last point we made in our letter was really around equitable access to information and services. The fact that in our community in Ottawa, where we have a high percentage of people who speak languages other than English and French, for example, Arabic or Somali, people were not getting information. People who identify as women were not getting information about, for example, social distancing measures, about what that means in terms of what they can do and how this might change their life and their movement through the city. So these were really the 4 areas that our letter addressed. I'm
Great.
going to
Thanks,
pass it on
Patricia.
to my colleague.
Thanks, Patricia. So I'm Valerie Stam. I'm the Executive Director of Cowie, and I am going to talk a little bit about what Cowie's been doing during these pandemic times. So when we wrote the open letter and we were hearing from people membership about the impact of the pandemic on their lives, we thought we should start gathering some data. And so we've developed an online survey that's just an ongoing survey. There's no deadline for responding to it. And there's a survey for our membership. So women from across the city, those who identify as women. And it's about how the pandemic is affecting their lives in this time, and specifically as women and what that means for them and the caregiving work that they're doing. We also have another survey for our partners, our organizational partners, to find out more about what those needs are that they're seeing on the ground. And we're also finally partnering with a PhD student at Carleton University, and she's doing research with lone mothers. And she's pivoted her research in this time to look at what's the impact of the pandemic on lone mothers specifically. So this is where we're getting a lot of our information from. In addition to this, we also are doing weekly check-ins with our membership, as well as partner organizations. And so the reason for these check-ins, really it's twofold. One is we wanted to create a space where people can just connect and talk to people to reduce some of the social isolation that we're all feeling. And also as a way to talk about specific issues. And so, for instance, this past Wednesday, we talked specifically about food security and had someone in from a partner organization who deals specifically with food security across the city. And so it was a chance for residents and for partners to ask questions to this resource person, and also a chance for them to share information about resources that they have. We're conducting research on what the impacts of the pandemic are around the world and how that might correlate to what we're experiencing in Ottawa and what are some lessons learned from around the world. And we also, as a result of the letter, were asked to sit on the city's Human Needs Task Force. And now this is a task force that the city struck very quickly once the pandemic was called. And it's comprised of city staff from many different departments, as well as Ottawa Public Health, and from partner agencies on the ground from a number of different sectors, such as the housing and homelessness sector, community health sector, the violence against women sector, et cetera. And so as a result of that, and knowing some of the challenges that we were hearing about on the ground, decided, and I'm the homelessness subcommittee of the Human Needs Force, which is particularly regarding people who are vulnerable, those vulnerable people in our communities, and the needs that they might have. In addition to this, we're conducting policy research around things that the city is planning or is doing or could do in terms of the pandemic, so pandemic response, and crafting some of our own recommendations based on what we're hearing from people. And we've also put together a media strategy so that we can reach out with the media and circulate the concerns that we're hearing and also the policy recommendations that we're making. So now we'll talk a bit about some of those stories that we've been hearing from the ground, from our members, and the intersectional gendered impacts of the pandemic more globally, and some of our recommendations. So Patricia will start us off there.
Yes, thanks, Valerie. So as Valerie has said, this information is really coming from a survey that Cowie has been conducting with our members, with our membership, reaching out to our membership to hear directly from our members how they've been impacted by COVID-19. And I want to start just with what we've been hearing about isolation and fear, and mixing that together with a lack of information. I think all of us are aware that during this COVID-19 pandemic, there has been so much information, and that it may become difficult sometimes for people to know where to go for information. What we've heard from people who are seniors in our community, newcomers, and those who are living with, many of them have been actually fearful of going outside. They're not sure what is allowed, what is not, and because changed at such a rapid state, at such a rapid pace, it has been difficult for people to know, what information, what is the right information at that time, and as well from people who identify as women and with disabilities. Some have identified fear that if they do go out, if they do leave their homes, that they're fearful that other people may not maintain their social distance. So there's been a sense of a lack of information circulating on what the social restrictions are. There is an equity issue here because we hear this most from newcomer communities as well, may not be, or is not widely spoken rather. So one of the recommendations from what we have heard that we conveyed in our letter is that it's really important that information on physical and social distancing measures be shared widely and in a timely manner and effectively, that it be translated into multiple languages, English and French, and that the city find ways to circulate it in many ways. So not just online, because obviously not everybody has access to online or to a computer or to the internet, but through radio, ads, news, community partners, assisting community infrastructure, whether it's community developers, for example, or other people who play a role of connectors in the community. We've spoken about in our recommendation the importance of sharing innovative ways using informal networks, which could be neighbor to neighbor, as well the use of community radio stations, which are often in higher usage in underserved communities. So this is on the issue of isolation and fear and lack of information. The other thing that we've been hearing from our members is really around policing and enforcement. So there's been an increased fear of people who are from groups that are already targeted by law enforcement. So for example, people who identify as racialized, people who already are policed at a much higher rate than communities that are non-racialized. And so we've seen in our parks, on our streets, that again, people have been complaining that they feel law enforcement disproportionately targeting them to enforce physical distancing. And so our recommendation in our letter to the mayor and city council was really that the focus should be on education, not on enforcement. That where city staff, such as librarians or even parks and recreation staff, where they might be redeployed to work, to do other kinds of work, community outreach in parks and other public spaces, serve in a sense as education ambassadors to assist people who may need the information that they don't have around the importance and of social physical distancing. And so again, the enforcement on the emphasis on education and not on enforcement. In addition, we have asked for information around sex and race disaggregated data. This is something that has also come from our own Ontario Human Rights Commissioner, who's made the request of the province and particularly the Minister of Health for information, disaggregated information on race when it comes to who is being disproportionately impacted by COVID. Jurisdictions such as the United States, in England, we are already beginning to see research that shows that certain communities, for example, in the US, African Americans are twice or three times more affected by COVID-19. So we would like information from public health around data, disaggregated data on race in particular, to give us a better picture of how the Ottawa community is being affected, and particularly people who are women who are racialized. So the last point I'm going to bring up, because before I pass this over to Valerie, is equitable access to green space. So one of the issues we brought up in the letter to the mayor was that there is not an equitable access to green space. So we have people in Ottawa in high density neighborhoods, living in apartments, in community housing, who do not have regular access to a green space, and in 19 pandemic do not safely have access to green space. During the pandemic so far, up until yesterday, in fact, we did not have access. Residents of Ottawa did not have access to public parks. Later on during the pandemic, that was relaxed to allow for people to walk through parks, but they could not linger. So you couldn't actually use the green space to, kick around a ball, for example, if you're a mom with a couple of children. And so we asked for safe access to green parks. We understand that there are issues around access to play structures, and also that people cannot congregate. However, access to green space is an issue around equity. In addition, from various councillors in our city, there have been a number of councillors who have come together to ask for green space. And finally, yesterday, we do now have access to parks, to green space, not to the play structures, and people cannot congregate. But thankfully, the residents of Ottawa now have access to green space. In some parts of the city as well, we have certain streets that are being shut down in order to give people access to distancing measures when people are walking, obviously, on public streets. With the kind of sidewalks that we have, and I'm sure where you live as well, for physical and social distance. So these are, I think, the last point I wanted to make is just around the issue of people who are single parents and single moms. What we have heard is from our members is that people have difficulty, obviously, taking their children to grocery stores. We've heard issues around people just having difficulties accessing something as simple as diapers for their infants. And we've heard about the added stress of having to parent and caregive while working from home, and teleschool, or provide education, schooling for children at home. So one of our recommendations was that childcare for essential workers be extended to single parent families as well. Pass it on to Valerie.
Thanks, Patricia. As you're well aware of, based on the talk that you had last week, I believe, there has been an increase in domestic violence. And we know that in some COVID-19 affected countries, they have already reported as many as triple the number of domestic violence cases. We're seeing similar patterns here in Ottawa, as I'm sure is very common in other places too. So violence against women and gender diverse people and children is on the rise, but one of the problems is that it's also more hidden now, because people are not able to home with their abusers. They may not have access to technology. Kids are not at school, so staff at school are not necessarily noticing when kids come in with signs of abuse. Something that we're asking for awareness of and greater response to as well. We're also hearing from our partners and our membership that one of the top needs continues to be food security. Women are often the primary caregivers in their families, so food often falls under their responsibility. In addition, for people who are street involved or couch surfing, food is a real, because the food that's available from food banks is really most appropriate for people who have access to kitchens. And there are organizations and community groups that have started offering food vouchers and gift cards so that people can go and get what's accessible to them or what's needed if they don't have kitchens. But not everybody's aware of where. We're also asking that the city act as a central information hub for everything related to food security, because the information right now is very piecemeal. You have to really search in different places to, and that's something that is being worked on. Housing. So in Ottawa, a housing crisis was declared in January of this year. And this has really strong impacts during COVID-19. So obviously, it's harder to isolate when your housing is precarious or you don't have access to housing at all. And women are overrepresented in the hidden homeless. And by hidden homeless, it means people who are couch surfing or who are temporarily friends. And in this sense, we're pointing out that housing is healthcare. If everyone is able to isolate in a safe, appropriate home, we would be better able to manage the pandemic. So we're currently working with the city and other partners to purchase or otherwise acquire hotels and other accommodations, those who are homeless, couch surfing, sleeping rough, or on shelter wait lists. And hopefully, this would be a long-term solution to the housing crisis that Ottawa is currently facing. There's also a need for increased testing services in shelters and for the homeless, and more accessible washroom, shower, laundry for folks who are street involved as well. We've been really pleased with different things that have been accomplished. Like Patricia said, there has been the relaxation of restrictions on access to green space, which is a really positive move. There's been volunteer groups that have started and been mobilized in different neighborhoods as like self-help support groups for people. There's been lots of outpouring of support for locally owned small businesses, particularly restaurants. And we've really seen the food community step up in Ottawa. One local restaurant is giving free meals and is doing online fundraising campaigns to be able to support that. There's been a lot of advocacy also around community gardens, for example, and in response to that, the province has reversed its decision that before they decided community gardens were not an essential service, and that decision was reversed about 2 weeks ago. So we're very happy with these progressive measures that have been taken. I'll turn it back over to Patricia just to wrap up quickly on what we see happening going forward.
So we are on a strict timeline here, and we really appreciate you listening in to this important webinar. I basically just want to end by thanking you all, and especially thanking the Southern Alberta. Thanking the council as well. And I also want to thank, obviously, Annalise and the moderator. I want to say that the pandemic has revealed the fault lines that are in our city of Ottawa, but it's also brought attention as the importance of grassroots organizations that are close to people, that are close to women and people who identify as women and gender diverse people. And so it has brought organizations like Cowie with an intersectional gender equity lens into sharp focus and the work that we do. And I think that's important. It's also revealed that equity inclusion is still not deeply embedded in our city's decision-making infrastructure, and that needs to change. And so the pandemic exposes, but hopefully it also proposes for us another way of living locally, sustainably, with an intersectional gender equity lens, putting women and gender diverse people, and above all, people at the center. Thank you.
Great. Thanks. So now we'll turn to Annalise. We're having a few technical difficulties. And she's going to be typing in her questions to us, and we'll read them out.
Okay, thank you both for that talk. Unfortunately, I've lost audio connection with our speakers, so we're just going to work via the chat so that I can ask questions and that I don't interrupt them unnecessarily. So bear with me on that. Our first question comes today from Trevor Page. What was the reaction of Mayor and Council to your recommendations on physical distancing?
I can start with that one. So we're very pleased with the decision that was made regarding the easing up of restrictions on green space. It did take a while to get to this point. The city's concerns were they were based on the recommendations that Ottawa Public Health was giving and that the provincial body on public health was giving as well, and so they were hesitant to make any hasty decisions there. But we feel, especially with the warmer weather coming, which I'm assuming is also coming in Lethbridge, that we were seeing more and more people on the streets and in public green spaces. And so I think the response to easing up some of the restrictions on the use of green space is a positive one. And we have been consistently acknowledging and supporting the work of Ottawa Public Health in terms of recognizing and doing more education on what the physical distancing requirements are and respecting those when out in public spaces. And so our calls have been always about creating more space for people so that they can have access to green space, but also in a manner that allows for adequate physical distancing. And this is where the piece on roads, I think, still is outstanding. Some city officials saying have responded individually in their wards to putting up pylons during certain hours to expand the distance available for pedestrians or people using forms of active transportation like bicycles, skateboards, rollerblades, to get places. So they've essentially taken over either parking lanes on roads or an additional lane of traffic. But that's been done so far piecemeal and hasn't been a response throughout the city.
Okay. Our next question comes from Timothy from the Lethbridge Herald. How many of these concerns are due to policies of local government and how much of it is related to personal fears? Are the policies reinforcing these fears? Are the policies reinforcing these fears, in your opinion?
Yeah, that's a great thought. I think there was a lot more fear circulating in the initial weeks of the pandemic. And as we're settling into a more long-term view of what means and what kind of isolation and quarantining we'll be needing to do for the foreseeable future, I think some of that fear on the personal level has relaxed a bit. But there still is a lot of fear, especially when it's tied to lack of information. And so I think sometimes these may come from, they're coming from knowing what what Ottawa Public Health is saying and what Ontario Public Health is saying, but then also concerns about how are people going to react in our communities, right? And so policies are crafted with these different ideas in mind. I think that times policies can exacerbate fears, particularly when there's not a lot of information circulated about the rationale for them. And so we saw that, and we continue to see that with access to green space, and what Patricia was saying earlier about seniors facing a lot of fear about going out, not being sure what they can or cannot do, people with disabilities who are worried about others not giving them enough space, folks who may have a need to sit down from time to time. They're not sure if they can use benches. Hopefully some of this is going to be cleared up in the coming days as we have these new these easing up of restrictions. I'll leave it at that for now. Patricia, do you want to add?
I guess what I would like to just add is that this is not in people's head. So when we talk about policing the pandemic, it's not a fear that is subjective alone. And in fact, we have organizations such as our own Ottawa Police that engage in a traffic stop race data showed that there were certain communities, so people who are racialized as Black or in quotations look like they're from the Middle East, okay, are policed and stopped in their vehicles at a rate that is 3 times more than the people members of those groups. So I think this, and there's data as well on carding and the extent to which young Black people in the city, especially young, are being carded as opposed to those who are not. So I think it's definitely, there's some objective data that we have, but we don't have obviously. But it's not, these fears are not in people's heads. These fears are not just there, they're actually real, and they're based on policy and unfortunately systemic discrimination that has been exhibited through policy, that has been practiced through policy. And so I do also want to answer the question of Knud Peterson. Do we have evidence that marginalized people in Ottawa have contracted COVID-19? And Valerie, please do step in if I've not answered this one correctly. But as far as I am aware at this stage, we do not have any of Ottawa. That's part of the problem. The City of Ottawa is not collecting that data. I know that Toronto Public Health, for example, has started an initiative to actually collect data on who COVID-19. We don't have such an initiative in Ottawa as far as I'm aware, and we are not therefore collecting that data.
One of our asks is around collecting sex disaggregated and race-based data, particularly related to the pandemic. And to Patricia's earlier point about fear, I think the one thing is really exposing is these policies are affecting people who are already marginalized in different ways. They're affecting them more profoundly. And these things we do know, right? Like we do know that racialized people face greater levels of law enforcement and policing, right? And so our worry when policing the pandemic, for instance, is that, again, it will be racialized people and Indigenous people facing the brunt of this policing. We have another question here from Bev Mundell. What city council committees does influence? What other community groups does Cowie work with to enhance your recommendations? This is a fantastic question, I'll start with the second part of the question in terms of what other community groups we work with. We have been really blessed with a wonderful coalition of support across Ottawa. We work very closely with the violence against women sector, work closely with the housing and homelessness sector. We have a relationship with the community health centers. And so this just gives you an idea. And so whenever an issue comes up or from our partners, what we try and do with that is always work in coalition. So we will always jointly work on messaging together so that we're all collectively asking for the same thing. And we'll jointly work on like strategy and how are we going to get our voices heard in different ways. In terms of city council committees, we don't sit on any council committees directly. We do right now co-chair with the city the Women and Gender Equity Strategy Working Group. So last year, the city decided to set up a Women and Gender Equity Strategy for the city, and Cowie's co-chairing that committee. Patricia, maybe you have some more of the historic piece there too in terms of council committees and.
Well, I think what I wanted to add is just that the relationship working in collaboration with the city. So since inception in 2000 and as a research action project, we've always worked with the city, even in advocacy. Even though we're advocating and our positions may often be contrary to positions the city is taking, we've worked in collaboration. So on that, I would just want to that, for example, we have done the equity and inclusion lens and provided training across the city, hundreds of city staff on integrating an equity and inclusion lens into city policy decision making, so that we've basically been one of the go-to organizations. We helped to develop that tool. I think Cowie is very, very proud of that work, and that's another example of that collaborative model that Cowie has been. Again, academia working with the city, and then working with grassroots women on the ground.
Mm-hmm. We have another question from Mark Gotil. Where does your funding come from, and is it adequate? Well, funding for women's organizations and feminist organizations has been and continues to be historically poor. So the bulk of our funding right now comes from WAGE, Women and Gender Equality Canada, formerly known as Status of Women. That's where the bulk of our funding comes from. And no, it is not adequate, unfortunately. And we continue to, apply for funding and types. We're also branching into starting a social enterprise of facilitations, diversity, equity, and inclusion. We already offer these services out in the community, and we do it for a fee. So that helps to subsidize some of our work. Yes. We have another question from Nude Peterson. Lots of talk. What silver linings might come about following COVID-19? I believe some issues about marginalized communities might benefit. Oh, that marginalized communities may benefit from some of these issues. Yes. Yeah, I think what Patricia was saying at the end, I really feel like there's two things happening broadly with this and what it's doing. One is that, and I'm taking this from Arundhati Roy's article called "The Pandemic is a Portal," right? And there she talks about how a pandemic really reveals the fault lines in our communities, in our societies, in our cities. But on the other hand, another world is possible. And we have this possibility of reimagining what things could look like at this juncture. I think it's a great opportunity to think about how can we live more sustainably, how can we live more locally, how we think about reinforcing or rejuvenating our social infrastructure, support networks that we had that have been historically defunded starting in the 80s and continuing on. So how can we think about creating the kind of place that we want to live in, which really does support all members of our community, so that they can.
And to that, I would just add, I think there's an opportunity here to really expose the importance of care work, which is largely the work of women, and how that work should be better paid, better supported, with better benefits, to ensure that people are not exposed or more vulnerable, which is currently the situation today, where we have women who bearing responsibilities, but also the impact of COVID-19 in terms of being more exposed to it given the work that they are doing in our communities.
And I also think it's very exciting to see what's happening on the ground in terms of the sort of local support networks that are popping up and who are coming together. Like there's a campaign in Ottawa, Keep Your Rent, which I think is also active in other cities. But there's a real solid level of community support going out and supporting each other, starting Facebook pages to give encouragement and support to people. And I think this coming together is that these connections remain strong going forward. Just seeing if we have any more questions from Annalise. Okay.
Okay, it looks like this is it for all the questions. I don't see any more. I want to thank both Patricia and Valerie very much for joining in and giving of their precious time to be in to join in here in Lethbridge. I just see another question come in. Are you okay to answer one more question? The question is from Graham Smith. Do you think the Trump mentality towards women is going to be addressed during this time, and finding a way through will evolve?
Wow.
Yeah.
That's a big question. I mean, I do want to say that I think it's very easy for us in Canada.
Sorry, did you both
to sometimes
hear that?
be a little bit self-righteous.
Oh. Do you see that question? Can you hear me?
Annalise, I'm not sure if you can hear us, but I think what I was saying is that I think sometimes it's easy for righteous here in Canada and to look to our neighbors to the south and say that's a Trump mentality. I think that mentality is still very present here in our communities, and the way in which we need to continue to counter it is in the way that organizations like Cowie are doing. And I think it's through this work in which we're trying to affect systemic change and not just like incremental change, that's where the opportunity is. And so I think that's where our focus is, and we'll continue.
Great. yeah, I think that wraps us up.
Okay,
Annalise,
perfect.
if you
So we're
want to
going
give
to
us a
sign
wrap
off.
up.
I'm going to thank you once again, and sorry for the audio difficulties between the three of us on the Skype connection. I certainly can't hear you. So thank you very much for being so flexible with me. And I'm going to stop the live stream now. So thank you very much.